So if you guys are that old, I'd stay off the roof, you know. Oh, this is interesting. And you were mentioning this about thyroid. How important is thyroid? I tell you, the more I get into this field that we call practicing medicine, which means you practice what you think you're doing, the more I'm thinking about thyroid. I measure mitochondrial function in all my patients, every single one of them. I've been doing it for almost 15 years. I use an oxygen uptake type of assessment to do that. When you do that in a resting state, what do you get? You get basal metabolic rate. What does thyroid do? It controls basal metabolic rate. In the old days, before we had these ridiculous things they call thyroid blood tests, which are absolutely useless, they used to determine if you needed thyroid based upon your metabolic rate. Because your metabolic rate's low, since thyroid controls metabolic rate, something's wrong there, right? Okay. You know how many patients I've seen with normal metabolic rates that have cancer of any kind, even your basic lumpectomy? 0. None. You know how many patients, how many people, period, over the age of 50 that have normal metabolic rates? Probably maybe 10%. There's almost nobody in this room that doesn't need thyroid. And particularly T3, because the number of mitochondria you have in your cells is literally controlled by T3 in a rate-limiting way. It's pretty amazing. There it is. There's sort of a demonstration of it. And you've got these uncoupling proteins in here and fatty acids going through here. And I'm not going to get into all this, thank God. Okay. But that's your basic mitochondria. They're the complexes through here, and protons are being pumped out here, and then the protons got to come back in here, and they either come back in here and make ATP, or they come back in through here to release the pressure, and guess what controls UPC3? Thyroid. Thyroid. The whole metabolic way your system works. If you think mitochondria important, think thyroid. Thyroid's really important. I don't think there's a patient you're going to treat with cancer of any kind that doesn't need thyroid replacement of some kind. And iodine. Okay. All right, so what's the most important nutrient you can take in your body? Is it vitamin C? Now, you can be without vitamin C for about 5 minutes, right? So what's the most important? It's obvious, okay? But this nutrient called oxygen is no different than any other nutrient. It's not what you take in that's important. You have a normal oxygen level in your blood. Who cares? It's what are you doing with it? Because oxygen only has one purpose. It only has one thing it does in the body, which I find to be very interesting. See, vitamin C and vitamin B and so forth have a multiplicity of things they do. Oxygen only has one thing it does, for all extent and purposes. And that's it gets converted into energy through the electron transport chain. That's kind of fascinating. So it only does one thing. So just because you have a decent level of oxygen in your blood and your O2 sat's fine, does that mean that you're utilizing oxygen properly? Not at all. I'm here to tell you, most people aren't utilizing oxygen properly. And I'm going to make a point that that is the fundamental cause of cancer. I'm going to show you 2 very interesting papers that I hope you all get and read that are going to tend to back up